Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And I'm so pleased today to be joined by Joe Bryce. Joe, it's great to have you here.
Thank you so much.
Your title is you are the RN manager for ERAS.
Correct.
I love the ERAS program. I've loved it since it started.
Thank you.
I think we're going to educate some people today about ERAS. We'll come back to that in a second. You've been at Albany Med for slightly more than 10 years. I think you got here in 2013.
Yes.
And you're a nurse and you started on C2.
Yes.
Describe to people the types of patients you cared for on C2, because I think that's important to understand as you talk about what you do now.
Correct. So when I started with C2, it was actually considered the short stay unit, which was really kind of odd because while there were patients that were there for only a few days, we had patients when I first started that were there 11 months and 9 months.
Oh boy, okay.
But it is the colorectal and now urologic floor. When I first started, it was just the colorectal population. And what really surprised me was how passionate I became about that type of nursing, because it really deals with qualities of life and educating patients on how we can help them reconfigure their lifestyle so that they have more quality of their life, more meaningful lives.
Now, I'm familiar with the types of patients who go there. You mentioned colorectal, right? These are the patients cared for by Dr. Ed Lee, Brian Valerian.
Absolutely.
Wonderful
Dr.
surgeons.
Chismark, yes.
Kennedy Chismark, absolutely. These are wonderful doctors. And then urology, obviously, is another population, right, which undergoes some complex surgery.
Absolutely.
Whether it be kidney tumor resections or some of our
bladder.
stone patients, bladder patients, etc. And those patients come to C2 afterwards, and they have a recovery period. And the nursing and the doctors work very closely with each other in those patients.
Absolutely. It's a lot of educating. It's a lot of helping them learn new ways to care for themselves and to rebuild their confidence that they can go forth and take care of themselves.
If you go back and you think about patients who were on C2 in 2013, 14, 15, you would recognize that many of those patients came out of surgery and often they required a significant amount of pain medication to help them through that, right? That was kind of how people were cared for back then. Let's take that now. You use some keywords: education, lifestyle modifications. We talked about pain medications. Let's fast forward to today. Now we have a program called ERAS. First of all, what does ERAS stand for? ERAS.
Enhanced Recovery After Surgery. And this program started in Albany Med in 2016. C2 was the pilot floor with PACU. And what impressed me from the beginning is, as a colorectal urologic nurse, I knew that getting out of bed was essential. Getting them to move. I knew that limiting the amount of opioids would give a better recovery, and we would avoid some complications that in the long run could add not only length of stay, but pain. But getting the patients to understand that I wasn't trying to be Nurse Ratchet, that really this was beneficial. So when they started this program, what I was really impressed about was this concept that we were going to educate patients ahead of time as to why these things were important, and that they were going to get this reinforcement from the surgeons, from the anesthesiologists, from the pain management team, and the nurses.
Let's break that down, because for those that are hearing about this program for the first time, you know, I certainly will never do it justice. There's so much more to it than we would be able to do in 10 minutes time. But essentially, it really changed the way surgeons and those caring for patients, anesthesiologists, nurses, the approach before surgery, during surgery, and after surgery. All three got changed. And there were changes that ultimately intended to make sure that when the patient was recovering, that they could mobilize quicker. They would have less need for narcotic pain medication, which tends to do things like slow down the gut or keeps them in bed longer. It allows them to be mobile, recover quicker, and ultimately have better outcomes. And let's go back. So as far as the education piece ahead of time, there's a significant component. If I'm coming in for surgery today and I'm a patient who's in the ERAS program, that's where you and your team help with the education.
Absolutely.
To talk about what that piece looks like.
So as soon as we find out that a patient is scheduled for surgery, the navigators, myself and my navigation team, of two other amazing nurses, we research
and what are their
that
names,
patient.
please?
Laura and Abby.
Okay, we thank them as well.
And we go into the file and we look at the patient holistically.
Right.
And the things that we're looking at are really focusing on how they move before they come in.
Right.
What's their pain history? What if things have worked for them? What haven't? Do they have the support psychologically that they're going to need for the surgery?
Right.
Are they nutritionally where they need to be or optimized? And what social support services? And then we meet with them for a good 30 to 40 minutes. And oftentimes what patients say is that it's the only time they feel that this whole process has slowed down enough for them to really grasp what they can do to help optimize themselves and to come up with a plan that will help them get through surgery.
And if we think about what this program is called, it's Enhanced Recovery After Surgery.
Correct.
You're educating patients, you're preparing them, you're letting them know what it's going to be like when they're in recovery, in the PACU, on the floor.
Absolutely.
And more importantly, why things are going to be that way. We want them to be mobile sooner. We want them not to be as dependent on pain medications.
Absolutely.
We want them eating and drinking as soon as it's safe to do so. And these are things that you're telling them so they're prepared for that.
Absolutely. We go from reviewing their past medical history, poking a little bit more into areas, to talking about our patient optimization bag, where we give them nutritional supplements. We have them doing incentive spirometers and a few other things, to really going through each step of the way and coming up with a recovery plan, because that's really important that they have a good plan for how they're going to recover at home before they even come in.
And you work closely not only with the surgeons, but obviously with the anesthesiologists who have a dedicated provider who often will follow up with those patients afterwards. People often think about anesthesiology as providing care only in the operating room, but in point of fact, not only do they meet with the patients ahead of time, there's always one who will often go to the floor after surgery and check in with them. They're part of the ERAS program too.
Correct. And really, I think of the navigator as almost air traffic control.
Right.
We make sure that any information that is needed gets dispersed to all areas of the team, so that everybody has what they need for this patient to have the most successful and safest surgery they can.
And we've seen, you use the word safe, which is wonderful, of course, quality, efficiency. We know, we've studied this now, we know that patients who have surgery with the ERAS program have better outcomes and stay in the hospital less. We know from some very significant studies, I'll reference Dr. Badr Mian, who's a urologist, has done a study that shows that essentially you can care for people with complex urologic surgery and for all intents and purposes use no narcotics.
Absolutely.
None. Which is wonderful, because we know that historically there was a significant amount of people who sadly became addicted to opioids post-operatively. And there's a huge focus now on reducing that opioid use in surgery, and you can come out of surgery, your pain can be well controlled, you can be mobile, you can be up, and you can go home quicker, which of course is wonderful, because obviously we want to use our beds efficiently. You're involved in all of that.
Absolutely. So then once we do all of that and we present it to our team, then when they come in for surgery, not only do they meet their anesthesiologist, they meet either an anesthesiologist or a nurse practitioner for our team that reviews. They do their localized anesthetic blocks. They're another support in the OR. They're checking them in post-op when they wake up, in PACU. And then our nurse practitioners, and I do want to take a moment to talk about them, because they are phenomenal. And they round on these patients every day, just like the surgical team, and they're looking at how they're eating, sleeping, and moving through the lens of pain. And they're looking at them holistically. So they're advocating for these patients on levels that are well outside, oftentimes, of just the pain. They're really looking at how do we enhance their recovery. And my navigators and myself, we also round on the patients on the floor daily. I think it's really helpful to have somebody in that moment who you've established a rapport with, who's coming in and saying, how are you feeling today? How emotionally are you? Reminding them of the reasons why they're doing certain things, offering to walk with them, getting them up. Sometimes even just listening to how they're feeling, because we have that time to be able to do that, and then add the extra support to the staff on the floor as well.
It is incredible. It's amazing to me how a program like this, it went from novel, unique, and quite frankly, even can we do this, to becoming the standard of care. And quite frankly, I think the model for how perioperative care should be done. We mentioned colorectal surgery. We mentioned urology. There are other surgical services that do ERAS.
General oncology.
Right.
We're
Excellent.
involved in all their major surgeries.
Excellent.
Neurospine.
Right.
We have actually 3 different levels. So we do the patients, we have a different range of what we do with patients that are going to
Right.
go home that same day within 23 hours.
Right.
And then the larger surgeries as well.
Wonderful.
We also do OBGYN oncology.
Excellent.
And we do some pediatric cases for colorectal and also the NUS procedure.
Right.
And we are also doing some with cabbages.
Wonderful. The cardiac surgery.
Yes, absolutely.
Wonderful. Well, it's a fantastic program. Like I said, from the very first, I remember sitting in Hike Auditorium the very first time I heard a presentation on this thing called ERAS. And I knew at the time that it would be something that we would want to do here, and we do it, I think, better than anybody. And I think a lot of that credit goes to you and your team, and obviously collaborating with the surgeons, with the anesthesiologists, with the NPs, with the other nurses. It's wonderful.
I want to thank Albany Med, because really it did go from an experiment to
Right.
This is something that really creates not only everything that you said, but also health equity, and it's something
Right.
that we should invest in. And while many hospitals across the nations have an enhanced recovery after surgery program, the level that you all have invested in this program, the amount of education that you all have put in for our patients really helps this program stand out even nationally.
Well, thank you for that. And I know we present on our findings now,
We do,
which is wonderful
absolutely.
as well. Let's take a moment. We just heard about Joe Bryce here at Albany Med employee. You mentioned the word health equity as well. I know you're involved in a couple important projects outside of work where you advocate for and work with the community. You want to talk about a couple of those areas that you're involved in?
I think growing up with parents that had a not-for-profit in Boston, when I was growing up, has definitely impressed upon both myself and my siblings. And years ago, during the beginning of the pandemic, I was driving home from Connecticut, and I was listening to NPR, and they were talking about findings from the Brandeis Group.
Okay.
And they had created this child success grading standard, and they had used it to assess on parts of Albany, North Albany and Arbor Hill. And out of 100 points that could be given, they gave 3.
Oh.
And I remember that night because it just broke my heart. And really, during the pandemic, when everything was so scary, and I was watching your videos and then still thinking, well, how do I go back into these communities, the communities that I grew up in and that people knew, and how do I help, and how do I bring Albany Med? Because one of the reasons I wanted to work here was that you all work with these communities, that we deal with the people here that are the most acute. And I was really like, well, what can I do? And that started getting me more involved with Leadership Academy, where actually at the time I decided to send my daughter, and they asked me to be a part of the board, and this year I am actually chair of the board.
Outstanding.
And through that, I also work with the program called ICANN, which is Russell Sage Leadership Academy and Albany Med, and I've done mentorship of hopeful to be nursing students through there, and I think it's just a phenomenal program. I know my mentee, I tell her all the time, I've gotten so much more from my work with her than she'll ever get from me.
Yeah, that's the way it usually works, right?
It's phenomenal. And I truly believe in mentorship. I've had some phenomenal mentors here at Albany Med, and I'm always so grateful. And I think it's essential to bringing the next generation in and creating that diversity that we need, not only in healthcare, but in education. I also work with Dr. Tina Omarobi, who works here, and a number of nurses throughout the Capital District of a wide background. It was really important to us to take our skills back into our communities and to be a bridge from what they may be hearing in the hospital or in their doctor's office. And we donate our time to do free blood pressure screenings.
Wonderful.
And we're not diagnosing, but to help educate on hypertension and also other chronic diseases. We look at ourselves as more of a bridge to kind of, very similar to what we do at ERAS, to filter the latest medical information into through a culturally sensitive lens, and help them understand either what they're already dealing with or what maybe conversations they could have better with their providers to get better help. And so through those different things.
Well, that's incredible work. One of the things I love about doing these videos is not just profiling what people do inside Albany Med, which is impressive, and the ERAS program is a perfect example of that, but it gives us a chance to explore the role we play in the community.
Yes.
And you're a perfect example. We've done many other videos in the past where people talk about what they do in their community with their time and their talent. Recently we interviewed Teresa Wyman talking about the service learning programs. Yes. Obviously what's happening with the Leadership Academy and ICANN are examples of where Albany Med wants to be impactful, not only when people come into the hospital to get care. We want to do pipeline strategies, we want to do workforce development, we want to be in the communities, and we are. And I think yours is another great story of where people are helping bring people into medicine. And obviously, if you're working with someone who's going to be a nurse someday, we would love that individual to work at Albany Med. But even if she or he ends up working at another hospital in the area, that's fine too, right? It's about making sure they have access to a great job and provide health care in the region, which is wonderful. It's wonderful. So thank you for that.
The more diversity that we have in healthcare, it impacts all of us.
We would love a workforce that is from our community, taking care of our community. We love that. One last thing. For fun, there's a story I heard about you and a penguin. So what is that? What is the penguin story?
My first degree is in fashion design.
Fashion design, I can see that.
I was working, doing an internship with a Boston-based couturier, and I was doing that in the mornings, and I was looking for a job that I could work in the afternoons and evenings. And a friend of mine came to me and said, you have a fine arts background. I said, yes. She goes, well, New England Aquarium is looking for somebody with a fine arts background to help create the new penguin tanks and exhibit.
Okay.
And I said, well, what's needed? And they're like, well, they need somebody who understands color and how to mix pigmentation. Okay. So I said, oh, okay. And I said, well, how much does it pay? And this was the 1990s, and they're like $15 an hour. And I'm like, I'm there. So they hired me, and I worked in their workshop in the Charlestown Navy Yard.
Sure.
And my technical term was I was a fiberglass fabricator.
Okay.
And we had these giant molds of huge rocks that were then put together to create these huge penguin tanks that are now still used in the exhibits.
And did the penguins like your work?
They seem to. They keep it. I always joke, well, it's not really a joke. I tell people it's not the lighting. The ones in the center are kind of red because it took me a little while to figure out.
Okay.
So some of those rocks are actually a little rosy colored, but it was an interesting experience, and it was an interesting 4 months. Well,
listen, we all bring diverse backgrounds to our job. That's a fun one. And honestly, what a unique thing to have on your resume.
My last night, I climbed out of the penguin tank,
and then they went in
straight into a spring fashion show.
Okay.
It was an interesting moment. I took off my gas mask, I put down my Sawzall and my Tyvek suit, and grabbed the clothing and went straight to the fashion show.
And today, here you are at Albany Med,
absolutely,
managing our ERAS program, which again is resulting in better outcomes for patients, reducing length of stay, providing a better patient experience, and ultimately really an incredibly important program. And I'm certainly grateful for it, and I really appreciate your leadership and the entire teams in this important program.
Thank you so much. And really, I do want to take a moment to say I appreciate how much support not only you, but really everybody at Albany Med has given to keep this program.
Well, let's keep it going.
All right.
Thank you, Joe Bryce. Thank you.